opening remarks and your questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary Designee Andrea Palm, and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Disease, and Ryan Nilstestoon, Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Thank you for joining us today. I want to begin by thanking all of you for doing your part to prevent the spread of COVID-19. Your efforts to maintain social distancing, the sacrifices you have made when it's come to your jobs, your schooling, and your day-to-day activities are what we need to flatten the curve to protect the people of our state. It's also what we need to do to support our healthcare workers who are making heroic efforts to test, treat, and prevent this virus. At the same time, we've also had to be patient with each other and ourselves because we're all doing this for the very first time. And there's bound to be some glitches along the way. We must remember that at the end of the day, we're all doing our best and we're all trying to do the right thing. And one of those glitches along the way has been the upcoming election. Folks, there's no real good answer to this. It's not an easy situation, and frankly, no one wishes this was easy as much as I do. This is, as I've said, a rapidly evolving situation. I've said that I would listen to the advice of the public health experts. I said I would let science be our guide, and we are. But as we've faced these challenges over the past few weeks, I have also asked the people of our state to do their part to help. Well, here's the bottom line, folks. If, as elected officials, we're going to expect the people of our state to make sacrifices to keep all of us safe, then, by golly, we better be willing to do our part too. So today I announce that I am calling the legislature into special session to do its part, just as all of us are, to help keep our neighbors, our families, and our communities safe. Folks, I can't do this or move this election or change it on my own. My hands are tied, and that's why I spoke to the legislative leaders about this weeks ago. I even publicly called on them to act. They have made it clear they are unwilling to change. I was hopeful that the courts would help intervene in this issue. All the while, I've moved ahead making plans for the election. I've called up the National Guard to help meet staffing needs at polls across our state. I've worked to provide PPE, cleaning supplies, hand sanitizer, and pens for every polling location. The bottom line is that I can't ignore that municipal leaders from Green Bay to Milwaukee to Waukesha significantly condensed the number of polling locations available, creating a dangerous situation where voters, staff, and volunteers will not be able to avoid large groups or practice social distancing when they go out to vote. This is a significant concern and a very unnecessary public health risk. I hope that the legislature will convene and take up a special session tomorrow for an up or down vote to send a ballot to every registered voter by May 19th, who hasn't already requested one, and to extend the time for those ballots to be received to May 26th. It's time for the legislature to do its part, just like all of us are, to help keep each other safe. And in addition to announcing the special session today, I am also announcing another important initiative. All of this, I know, has caused considerable stress on everyone. For some, it has increased our anxiety and has led to depression. That is why today I'm announcing Resilient Wisconsin. And while Resilient Wisconsin will be an ongoing initiative, we cannot think of a more important time to launch this website and resources designed to connect and build resiliency for Wisconsinites affected by trauma, toxic stress, and other mental and behavioral challenges. My first teaching job was teaching science in Baraboo. Did you know that resilience is actually a science term? It comes from physics, and it refers to the ability of a material to absorb and then release energy to return to its original shape. But for us today, as we face the ongoing challenges of COVID-19 in Wisconsin, resilience is how we will band together and grow as a state in the face of unprecedented times. Resilience is our ability to recover from adversity. It's our ability to adjust to change, and it's our ability to deal with difficulties. Resilience does not mean you don't experience stress. It means you're using tools to be kind to and take good care of yourself and stay connected with folks around you, all to help to reduce your stress. And being resilient doesn't have to mean being alone. Supportive relationships keep us grounded. And while physical distancing might make maintaining that connection harder, it also makes it even more important. Even in this time of physical distancing, we all need to remember the importance of the human connection. And to our first responders and healthcare professionals who we know are experiencing the stress on the front lines of the pandemic, let me say this: we are here for you and we see you. As we work to flatten the curve, we see your dedication. We know the work you're putting in to keep us safe. And we know surely it must be exhausting. And you know what, folks? It's okay for heroes to ask for help too. That's what resilience is all about. All of us learning it's okay to lean on and depend on each other during the worst of times. I've used the word resilience a lot today. That's because that is what Wisconsin is and who we are. It is true that COVID-19 is a new challenge and that it has brought significant change to our lives. But what I also know about this state is, having spending most of my life here, Wisconsin is resilient. You are resilient. We are more resilient together, and resilience is the way forward. So thank you so much, and I'll now turn it over to Secretary Designee Andrea Powell.
Thank you, Governor Evers. Good afternoon, and thank you all again for joining us here today. I know I usually start with the numbers, and those numbers are important, and I'll circle back to them, but I want to take a moment to talk about some different numbers. I want to talk about the thousands of first responders and medical professionals and clinic support staff on the front lines of COVID-19. I want to talk about the thousands of teachers doing their best to continue educating and supporting our children through this difficult time. Thanks as well to the grocery clerks and gas station attendants and warehouse workers and delivery drivers. A big debt of gratitude belongs to the millions of Wisconsin residents protecting each other by following Safer at Home, because we know that flattening the curve is how we save lives. And I want to acknowledge those of you worried about loved ones who are sick with COVID-19 and to honor those who are grieving loved ones who have passed away. This is all difficult work, and I want to acknowledge and thank you for that work. Staying safer at home is so important, but we know that it isn't easy. We want to make sure you have the tools to care for yourself, to stay connected, and to reduce stress when possible. And our website, resilient.wisconsin.gov, provides information on these tools and additional resources to explore about caring for yourself, about staying connected, and about reducing your stress. It may seem selfish to prioritize your own needs at a time like this, but in reality, it's not selfish, it's self-care. We need that self-care to deal with our stress and make it possible to care for others around us and stay connected. Supportive relationships keep us grounded, and physical distancing can make maintaining that connection harder. It also makes it even more important. We can't change our current reality, but we can change how we react to that stress. One of the most effective ways to reduce stress is to reduce your risk of infection. Wash your hands for at least 20 seconds. Use soap and water. Cover your coughs and sneezes. When you leave your home for essential trips to the grocery store or pharmacy, please remember to stay 6 feet apart from others. And remember, you are safer at home. Knowing that you are doing all you can to flatten the curve in our state can help relieve some of that worry. But sometimes these strategies aren't enough, and we want you to know that it's okay to ask for help. We know that feelings of isolation, economic hardship, or fear of getting sick, that all of these can pile up and make us feel overwhelmed, anxious, or depressed. Telling someone about these feelings isn't a sign of weakness. It can be a necessary tool to survive in this ever-changing situation. So I encourage everyone to visit resilient.wisconsin.gov wisconsin.gov to find the resources you need to build resilience and bounce back from this tremendous disruption in all of our lives. I now want to turn back to the numbers that I usually start with. So today, we have 22,377 negative tests in Wisconsin, 1,916 positive tests, and 37 deaths from COVID-19. Of those 6 new deaths, 1 is a male in Dane County in his 80s, 3 are Milwaukee County residents, a female in her 70s, a male in his 70s, and a female in her 80s. And the final 2 new deaths today are in Ozaukee County, a male in his 70s and a female in her 90s. Today, we have 2 additional counties reporting cases for the first time, Rusk and Barron. Our hearts are with the loved ones of the people who have passed, as we have said many times, and I know that you certainly share that sentiment. And we wish for those who have been diagnosed with COVID-19 a quick recovery. In all areas of public health, data is an important tool, and the numbers do tell us a story. This week, we added new information to our COVID-19 data webpage. In addition to case counts and case counts by county, we're now providing the number of hospitalizations, cases by date, and the cumulative total cases by date that have been confirmed. Keep watching, there is more to come. But collecting and disseminating data isn't as easy as 1, 2, 3. Our data team reviews each piece of information we collect for accuracy. And although it is a thorough process, when it comes to being transparent and providing you a true picture of that situation, it is important that we get it right. We look forward to bringing you more information as we continue to analyze and collect data on this pandemic and its effects on Wisconsin. As a final note, I want to point out that next week is Public Health Week. So I want to take this opportunity to acknowledge our local and tribal health officers who, like our healthcare providers, have been on the front lines since day one. You are true partners, and we could not respond to this pandemic without you. Finally, while the numbers may not seem like you're making a difference, believe me, you are. Please continue to remain patient and stay safer at home. With everyone doing their part, we will bounce back from this pandemic. Thank you.
Thank you, and we'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And for the sake of time, we also want to remind you that we are taking 1 question per reporter per outlet. And we'll begin today with Sean Kirkby from Wisconsin Health News. Sean? And a reminder, *6 to unmute your phone. Sean Kirkby from Wisconsin Health News.
Hi, this is actually Tim from Wisconsin Health News.
Go ahead.
Hi, I had a question on unrelated to the election, but related to a call made by Milwaukee leaders yesterday for the state to work with the Army Corps of Engineers to build a field hospital at the state fairgrounds in West Dallas. Is that something, Governor, that you plan to work with them to do, and are there plans to build any other field hospitals to also leave capacity at area hospitals, either in Milwaukee or Madison, other parts of the state?
So this is Andrea. There are 2 localities who are currently exploring and pursuing surge capacity, these alternative care facilities, with their leadership and in partnership with us, we did ask the Army Corps of Engineers to help evaluate sites for consideration by localities. And as you mentioned, Milwaukee has chosen a site, and they are currently working on their staffing and resource plans, what they would need to build out an alternate care facility. And we do continue to work closely with them as they move through this process, with the intention, as you said, of standing up an alternate care facility to handle any surge that they might face.
Thank you. Moving on then to the Wisconsin Examiner and Melanie Conklin. Melanie? Melanie Conklin with Wisconsin Examiner. And And a reminder, star 6 to unmute your phone. Okay, we'll move on to Stephanie Hoff from WIS Politics. Stephanie?
Hi, I'm just wondering if someone can talk about the crisis within a crisis that's happening right now in Milwaukee with the disproportionate amount of African Americans having COVID-19.
Sure. So we're watching very closely the numbers statewide, but paying particular attention to areas of where the number of increased cases every day seems to be highest. As has happened in a lot of the country, the urban areas where the population is most dense seem to be places where the epidemic seems to take off most quickly, most likely because people are generally in closer proximity to each other. That's certainly been the case nationwide with the cases in New York City really accelerating. I think that's only part of it, though. We know in Milwaukee County, in our urban communities, particularly our poor urban communities and our ethnic minority communities, that there's health disparities through a large range of health conditions, and those have to do with both social living economic situations, but also healthcare resources. So one of the things we're really focused on is not just counting and just doing epidemiology, but actually getting health services to areas where the cases are, because not just getting tested is what's needed, but getting medical evaluations and giving good advice for families and communities for people who have been exposed. So we need to put our efforts most vigorously where the cases are, and right now it's in the urban areas where the population is density, and unfortunately and tragically, those areas are also where health services tend to be the least robust and where the need tends to be greatest. So that's really been our priority, is to try to reduce health disparities in urban populations.
No, just sort of from a systems level, beyond the science that Dr. Westergaard talked about, we are working very closely with our partners on the ground in Milwaukee and have surged a number of resources to them, including some, actually a large number of additional contact tracers and epidemiologists, and are working with them very closely as they work through this on the front lines to make sure that they have what they need to be most responsive, to be most effectively responsive to what's going on the ground there.
Thank you, Stephanie. Now to Bram Sable-Smith from Wisconsin Watch. Bram?
Yeah, hi. Hi, thanks for taking my call, and as always, thanks for keeping these communication lines open. So my question is, hospitals alone have filed over 100 medical debt collection suits since the public health emergency was declared. Some now are saying they're pausing that practice on their own. But my question for the governor is, do you possess the authority to take action on medical debt collections, similar to the actions taken on pausing evictions and foreclosures? And is that something you have or are considering?
I'm going to turn that over to Ryan Milsister.
So that is something that we, has come into the news recently in terms of the number of debt collections that have happened. I think it is something we're looking into. That said, there is a fairly significant difference between debt collection and the eviction ban. So the reason for the eviction ban was because while Safer at Home is in place, we're encouraging people to stay at home as much as possible. And to evict somebody from their home during that time runs completely contrary to that. So that's the rationale in terms of the eviction ban and why you've seen similar actions in other states. But again, that's in terms of medical debt collection, it's something we are looking at, but it is significantly different than the eviction ban.
Thank you, Bram. Now to Shaquille Brewster from NBC. Shaquille? And a reminder, star 6 to unmute your phones. Shaquille Brewster. Okay, we'll move on then to Scott Bauer from Associated Press. Scott?
Hi, thanks again for doing this call. Governor, have you spoken with Republican legislative leaders? Do you have any guarantee or promise from them that they will take action tomorrow as you've called for?
I called and left messages for both of them. Have not received back, but I truly believe that they understand as well as I do. This is a time for leadership and to and to move this position forward in a way that works for the people of Wisconsin. I know they understand it. We talked about it earlier, several weeks ago with them personally, and they see what I see, and we're seeing a surge in southeast Wisconsin as it relates to what's going on the ground there with deaths and numbers of people that are showing positive signs of the virus. And also, we're also seeing what's going on with our municipalities, and reducing the number of polling places creates a significant problem for us. We've even had a polling official quit in southwest Wisconsin. Waukesha is looking at one polling site itself. So this is a time for us to kind of set aside whatever disagreements we've had in the past, what we're looking at going forward. We need to change the dialogue. Our proposal that we will be putting in front of the legislature is a good one, and it'll solve a lot of issues for us.
Thank you, Scott. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, hello, can you hear me?
Yes, we can.
Yeah, thank you very much for the time today. I was just curious if, there would be any response to kind of criticism regarding this latest order kind of coming down to the wire, kind of the 11th hour with the election just on Tuesday. Is that something that you think is going to make this difficult to pass, or are you confident that GOP lawmakers are going to, take this stuff seriously?
Yeah, well, there's no givens in this world, and this isn't new with me. I talked to the leadership several weeks ago about this, that in-place elections is a problem. And so the issue is that we tried before. The times have changed. It's even more complex, obviously. As I mentioned before, the surge in southeast Wisconsin is clearer now than before, as our famous doctor that works with Donald Trump says, is that the virus sets a timetable, not us, not the human beings. And it's clear that the virus is telling us that we're going to have a surge there. And several large municipalities just recently closed or reduced the number of polling places. So, yeah, it's late in the game, there's no question. But it's things that have been discussed before. People have had a time to chew on it, and I'm hopeful that common sense will prevail and we'll be able to get some solutions to this.
Thank you, Mitchell. Now to Bob Haig from Wisconsin Radio Network. Bob? Bob Haig? Okay, we'll move on then to Shemaine Mills from Wisconsin Public Radio. Shemaine?
My question's been answered. Thank you.
Okay, thank you. To Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. Governor Evers, this question is for you. You made it clear in previous press briefings that the need for an election is due in many cases to needing to put municipal and county officials into place as their terms are ending in April. That also goes for school board officials. That also goes for school referenda. We're waiting till the end of May until votes are returned and ballots are counted according to what you're proposing here. How do you anticipate that will work? Will terms of elected officials be extended beyond when they were originally elected for?
Yes, that's part of the ask for the legislature.
Thank you, Ben. Now to Bruce Marcus from WRJO Radio in Eagle River. Bruce? And a reminder, *6 to unmute your phones. Bruce Marcus from WRJO. Okay, we're moving on then to Sarah Thompson from WBAY-TV in Green Bay. Sarah?
Good afternoon. This would be another question for the governor on the election. You mentioned earlier, and named Green Bay specifically, there being a significant concern and calling it an unnecessary move to combine those polling locations. What is the biggest concern that you have there, and what should they be doing to avoid those larger crowds?
Well, that's just it. If you reduce the number of polling places, you increase the number of people that are there, and therefore increase the chances that social distancing is not only an afterthought, it just won't happen. So that's my concern. Local officials are in charge of doing that. They've made the decisions. I'm responding to it by trying to make sure that the legislature takes this up, passes it, and moves it forward.
Thank you, Sarah. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben?
Yes, this is for Dr. Westergaard. What do you believe needs to happen for us to return to normal living? Is it a vaccine, a certain drop in cases, or something else?
Yeah, it's a good question. So on the vaccine question, the ability to have a vaccine that could prevent transmission of the virus is going to be probably the biggest single advance in reducing the burden of this infectious disease. But unfortunately, we think the best case scenario is that it's a year or more away. There are some promising candidates that are going to be starting in clinical trials. So an effective vaccine is a hope for the future, but it's not going to be in the next year in terms of turning the curve. So I think when we talk about when is it going to be safe to get back out into the community and life to resume some semblance of normal, we really think there's two things. The first is that we're watching very closely the epidemic curve, and we want to make sure that we have endured and gotten through this first wave. Right now, the number of cases is still going up. We're still seeing that we're at the beginning of this hill going up. And there's some models, some forecasts on a number of websites internationally that have been shown this, what is likely to happen given what we know about how this virus works. And we want to make sure that we're through the worst of it and things are looking better. That's the first thing. The second thing is that we want to be very confident that we have our public health infrastructure ready to take on the second phase and potential future waves of infection while we don't have a vaccine. So that's the things that Secretary Palm was talking about, is making sure that we have really robust systems in local public health to identify people, test people on a much more wide scale than we can now, investigate clusters of diseases, isolate people who have symptoms, quarantine people, which means keep them separated for those who have been exposed. And we're confident that we can do all those things really well, but it's going to take a lot more resources than local public health typically has right now. So we need to build that workforce. We also need to develop systems to do things on a larger scale and coordinate those efforts on a larger scale than we have in the past. So the flattening the curve, the safer at home order has done both of those things. It's given us time to prepare for the next year before we have the vaccine, but it's also minimizing the spread, how rapidly the infection spreads through the community, so the number of sick people stays at a manageable level. So I think we really want to see that we've made substantial progress on both of those things in the coming weeks before we feel like it's safe to return to some more normal activities.
Thank you, Ben. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
We had, this will be a 189 case jump over yesterday, which, if memory serves, is the largest one we've seen so far. What do you kind of attribute to that? Is this a situation where the testing is simply becoming more efficient, or is this an increase in the pandemic curve, as people have been saying?
Yeah, thanks for that question. My recollection was that the increase between Wednesday and Thursday this week was 199. Yeah, that's right. So it's up there. But I think the important point is, clearly the number of cases is growing, but it's growing in what we call a linear fashion, which means it's gone up by about 180 to 190 this week. Things can definitely change, but a week ago when we were talking about what did we want to see to know whether we're making a difference, we really thought that this week was critical, because what the forecasts show and what the data from China in the first month was that these infectious diseases can grow exponentially, which means it goes up by 100 one day, the next day it goes up by 200, then it goes up by 400, and then 800. And that's how communicable disease epidemics rapidly disseminate through a population. And that's what we know about this virus was likely to happen if we didn't dramatically restrict movement of individuals. So the fact that we're seeing cases go up by the same amount every day, 180, 190 this week, is actually very good news. It's actually really encouraging that we are flattening the curve, because we've seen in the early, really dramatic, rapidly increasing phases of the epidemic elsewhere, like we know what this virus can do. We know how contagious it is, and we know that when people interact in the normal way, it really takes over a population rapidly. So so that's, a glimmer of hope that what we're doing is actually making a big difference, and I think that it is. Is the question of is the increased number of cases a result of increased testing? It might be. But I think the other message that we've said earlier this week is that our laboratory capacity does not seem to be a rate-limiting step right now. We have about 50% more tests that we can do a day that have been ordered by clinicians. So it's not a limitation right now on the laboratory side. So with every patient for whom a test has been ordered has been getting done in sort of the standard turnaround time. So I think it really is, that's what we're seeing. I think people who are symptomatic requiring hospitalization are getting tested as intended, and these are the numbers that we're seeing. So we're not out of the woods, but this week I think taught us a lot about how relatively well things are going compared to what they would look like if we weren't doing the physical distancing that we've recommended.
Thank you, Rob. Now to Addie Bink from WFRV TV. Addie?
Hi, yeah. I was just wondering if there was any data available for how many hospital beds that Wisconsin currently has available.
So we do have we have a number of total hospital beds in the state of Wisconsin, which is just shy of 11,000. We continue to work with our hospitals and have built out a technology platform for them to be able to, in real time on a daily basis, provide additional information to us about occupancy rates, about how many of those folks are COVID versus non-COVID, et cetera. And so we are working very closely with them to be able to continue to provide additional information about the very specific things you're talking about.
Thank you, Addie. Now to John Neiser from NBC 26. John?
Abigail sitting in for John. My question is for the governor. Just looking at the federal stimulus plan, it looks as if Wisconsin has about $1.8 billion to spend. I'm just wondering where you want to see that money go and what parts.
Oh, we're just in the beginning stages of discussion around that. Clearly, there's lots of needs. There's an extraordinarily a number of needs, whether it's helping local public health officials do their job, whether it's making sure that our business community, especially our small business community, is made whole, may be way too difficult, but that we give them a head start in recovering. And of course, we have issues at the state level. So, but we're just in the beginning discussions on that, and frankly, we're also waiting for final regulations from the federal government. The Treasury Department said that they might have some regulations in mid-April with releasing of money in the end of April. So we're a long way from making those decisions soup, but we're beginning the conversations not only with our staff and others across the state, but with the legislature.
Thank you, Abigail. Now to Jessica Van Egren from Up North News. Jessica?
Hi, I have a question in regards to the election as well for Governor Evers. Just curious, were you not expecting polling places to consolidate or close as they seem to have done, especially in Milwaukee and the city of Green Bay?
Well, those decisions are local, and they're not always shared with me personally. But here's the deal. I mean, I'm not looking to blame decision-making on the local level. Certainly, it has gives us great pause when Milwaukee or Waukesha, as I mentioned before, one polling place, they did that for their own specific reasons, but that has significant health care ramifications. So I'm not sitting here trying to point fingers. I'm trying to solve this thing. This is an issue that the legislature and I need to figure out. And that's exactly why I called the session for tomorrow, and I believe we can get to a place that works for all of Wisconsin. But clearly, if the number of poll places are down, that means that it's going to be much, much more difficult for social distancing.
Thank you, Jessica. Now to Jeff Thalen from WSAW TV in Wausau. Jeff? And a reminder, *6 to unmute your phones. Jeff Thalen from WSAW. Okay, we'll move on then to Mason Dowling from WAOW in Wausau. Mason? Mason Dowling? Then we'll move on to Parker Shore from the Cap Times in Madison. Parker?
Hi, thank you. Do you have any figures about the total availability of other essential resources? You said the available hospital beds, but I'm curious if you have any current figures on ICU beds or ventilators, and if so, can you share those numbers?
So I do also think that starting today on the website, like hospitalizations, we will include some new data on those who have required ICU care. But again, it is there is not a state data warehouse that includes all the EHR records of the people of the state of Wisconsin, right? That is something that hospital and healthcare systems own and control, and we are very actively working with all of those folks to build a way for them to report that kind of information to us on a more real-time basis so that we can not only be able to share it with the public, but also to inform the planning that needs to be happening to dig in a more regional way in what's going on with the outbreak around the state, so that we can really, as Ryan mentioned, as we are flattening the curve and doing the work we need to manage this very actively moving forward, that kind of information is going to be critical to those efforts. And so we're very actively engaged with our hospital and local health system partners to get the information that we need to do that and be able to turn that around for the public.
Thank you, Parker. Now to Matt Cash from WKOW TV in Madison. Matt?
Hi, this is Emily in replacement of Matt from WKOW. My question is for the governor. So far, the special sessions you've called as governor, GOP leaders have refused to meet. So why do you think this time will be different?
Certainly, we haven't experienced anything like that in my lifetime or the legislative leaders. So I believe the time is now. The time is to lead. I understand that they rejected a similar proposal in the future, or in the past, excuse me. But this is different. We have a surge going on. As I said before, the virus sets a timetable, not me, not Robin Voss, and not Scott Fitzgerald. So the time is now, and we have a plan, I believe, that can work, and so we're looking forward to a solution.
Thank you, Emily. Now to Stephanie Fryer from WISC in Madison. Stephanie? Stephanie from News 3.
Hi, can you hear me?
Yes, we can.
Sorry. I'm in for Stephanie. Just a logistical question for the governor. How do you plan on holding the special session tomorrow? Was it going to be like a Zoom call, or since you can't actually meet in person if there were more than 10 people?
It's the special session is governed by each of the houses.
Moving on then to Taj Mahal from NBC 15. Tajma? And a reminder, *6 to unmute your phones. Taj Mahal from NBC 15. Okay, we'll move on then to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for taking this call. This question is for the governor. Governor, what will you do if Republican leaders of the legislature don't take up these measures? Well,
I believe they will, and I believe we'll be able to reach a satisfactory conclusion. So I sit here telling you that the time is now for the leadership and all the people that are part of Senate and Assembly to step to the plate and do what's necessary to make sure that we have safety in the state, and also that we have an election that we will be using mail ballots for. So I believe that they're people of goodwill, and we're going to get there.
Thank you, Molly. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
For the Secretary, what types of data, you mentioned that there's more coming, what should we be looking for?
So I think the things we, as we have sort of throughout this, the kind of information that we're interested in making sure people have access to is information that advances the public health and helps people stay safe and understand what's going on. And so, again, we are very actively prioritizing that kind of work with our hospital partners, because obviously they got a lot going on too. And so, you know, if we can prioritize 15 things instead of the 100, that would be awesome to have. That is the conversation we are having right now. But I think the things that we are most focused on are around the capacity of our healthcare systems, right? That is what our primary goal is to make sure that we are flattening the curve so that we can serve all those who need treatment in hospitals in the most effective way. And so the focus of our conversation is around knowing and understanding those variables and at a regional and a local level, so that hospital systems and small hospitals and clinics and other parts of the system can work together on the things they need to do to be ready for a surge.
Thank you, Jeremy. Now to Mark Stevens from CBS 58 in Milwaukee. Mark?
Andrea, there's been some news that there might be some relaxed guidelines on face masks. It's going to be a nice weekend. Should people who are venturing out and about in public who are healthy, should they be wearing some type of cloth mask, scarf, bandana, be whatever, to cover themselves?
Mm-hmm. Yeah, this continues to evolve, and Dr. Westergaard's been tracking the science on this pretty closely, so I'm going to let him say smart things about this.
Yeah, thanks for bringing it up. There has definitely been some evolution about how we understand about this. So I'll start with what we know well in the healthcare setting, because I think it's really important to look at these two things separately. You know, in healthcare settings, when nurses and doctors are caring for patients, it's now pretty well known that cloth masks don't protect as well as the standard procedure or surgical masks. They get saturated with moisture, the viruses can go through them. So it's very important that those are not used in healthcare settings because it's putting people at risk. And then furthermore, and this has really been the principle that informed this conversation in this country, is that because there's a shortage of those effective medical grade masks, we really did not want people in the general public to wear masks because we needed to conserve them for those patient care areas. So the issue is now becoming sort of more accepted in the public and also in public health that, well, can people wear the cloth masks in public, not as a way to protect themselves from the virus, but really something in the category of respiratory etiquette, meaning if people can transmit the virus just by breathing or coughing and sneezing, is it good for the community for people to wear masks? And the answer is it probably is. You know, we don't have studies proving this, but certainly a lot of areas of the world, this has been a more accepted practice. And we think, and I think this is what the evolving guidance is going to be, is that those probably are safe things, provided that we don't see them as a replacement for all the other things that we've talked about, primarily being hand hygiene. So people shouldn't feel like they're more safe because they're wearing a cloth face cover in public, and then they would be less likely to wash their hands or stay separate or wash surfaces and disinfect surfaces. So the short answer is yes. We think that's becoming more widespread. We're going to follow the lead of the CDC, who I think is probably going to make sort of public recommendations. But that's really how the thinking has been. We think cloth public for people who are cloth masks, which are really face covers for preventing respiratory droplets from getting into the environment in the general population. But we really want to emphasize that the procedure masks that filter the air, or the ones that are used in medical settings, really need to be reserved for healthcare, because there's a potential for critical shortages of those in both long-term care facilities like nursing homes and hospitals. So that's really our number one priority, because we have very strong evidence that that saves lives, is having procedure masks for healthcare workers, cloth masks for the general public. It seems like we're going in that direction, but the science isn't quite as strong right now.
Thank you, Mark. Now to Taylor from Fox 6 in Milwaukee. Taylor? Fox 6? And a reminder, star 6 to unmute your phones. Fox 6 in Milwaukee. We'll move on then to Mary.
Hi, this is Cecile from earlier. Would I be able to jump in with my question? I finally was able to unmute my phone.
Who is this? Go ahead, please.
Cecile Brewster with NBC News.
Go ahead.
Thank you. This is for the governor. A similar situation happened in Ohio about 2 or 3 weeks ago, where the governor and a judge weren't able to change the date, but instead the health department director came out and essentially ordered the polls closed as a health emergency. Can you explain why you're not able to do that? And then just separately, for people who are going out on Tuesday or planning to go out, can you just explain why you didn't make this call? This is the first time, from my understanding, that you made the call to change the date. Why didn't you make this call earlier when the crisis first broke out?
Oh, I did. You must have missed it. I worked with the legislators several weeks ago and talking about this exact same thing. And they weren't interested. I believe they will be interested now. The idea that somehow this is just brand new news to me is incorrect. Obviously, I knew it before because I broached it before with the legislative leaders. In addition, the surge in Wisconsin is a real thing, and it has become more apparent in recent days than it has been in the past. So that figured into this discussion. The third thing, as I said before, the number of polling places has been reduced by local municipalities. And when you reduce those, you obviously increase the difficulty with social distancing. You know, we spent a fair amount of time trying to resolve the issue of making it safe in the polling places. We delivered pens to every site. We delivered making sure that we had hand sanitizer, gloves, you name it, so that people could have a safe election. We also, polling places or polling officials are saying they didn't have enough people. We commissioned the National Guard's men and women that are our neighbors in municipalities all across the state of Wisconsin to fill those if necessary. The fact of the matter is, the local officials who make those decisions have decided that in many cases they're reducing the number of polling places, which obviously is a problem. So that's the story here. We are looking forward to having a great conversation with the legislature to make this a mail-in ballot and to move our state forward.
And I'd just like to add, to clarify that, the governor had multiple conversations with the legislative leadership about the mail-in ballot issue. The reason why, that was earlier, and now that we're close to election, it necessitates the need in order to move the dates back in order to make it a process to work. So that's what's changed, is that, one, the situation on the ground has gotten more serious. The polling locations have been condensed, and so thus the need to call for extending the election out farther is the difference than where we were a few weeks ago.
Okay, thank you. Moving on now to Mary Jo Ola at TMJ4 in Milwaukee. Mary Jo?
Hi, can you hear me?
Yes, we can.
Okay, great. Thanks for taking my question. Just wanted to see what more you guys can tell us about the nearly 100 state health workers that are in Milwaukee and or the Milwaukee area. What are they doing as far as the type of work, and are there specific areas that they're focusing on?
Yeah, so these are the folks that, in our conversations with the city of Milwaukee, they articulated as a place where we could be really helpful to them. And so those 100 folks are specifically deployed doing contact tracing. So again, as a very basic and fundamental public health tool, every suspected and confirmed case is contact traced, so that we are wrapping around that person and all the folks they had contact with who they might have infected to figure out who's at risk for that, how to make sure they go into isolation. The daily check-ins are happening with them to make sure that they are monitoring symptoms, that they are remaining healthy and well in isolation, but that takes considerable boots on the ground. And so that was a place where, through our conversations with city officials, they thought that they could use some help from us, and we were glad to be able to provide it.
Thank you, Mary Jo. Now to Matt Sin from WISN in Milwaukee. Matt?
Hello, Governor. When you were asked about the logistics of the special session, you said that the special session is governed by each of the houses. Can you elaborate on how they would hold the special session? Are you just saying essentially it's up to them to figure it out?
Yeah, I mean, I know, I can't speak for either one, so the answer is yes, but I know that the Senate has practiced with video, or, you know, when everybody isn't there, they're actually calling in. I know that, but believe me, if I was in charge of the legislature, we may not be here at this point. But the fact of the matter is, our friends Robin Voss and Scott Fitzgerald will determine how they meet, and whether they come down to Madison or whether they do it in another way that they find convenient.
Thank you, Matt. Now to Matt Piper from the Sheboygan Press. Matt? And a reminder, *6 to unmute your phones. Matt Piper?
Yeah, thank you again for taking my call. The site now has a Wisconsin model on it, and I believe this is new. I don't think I've seen it here before. The model itself is from late March, I think. Dr. Westergaard, could you just explain to me whether the projected peak of 3 to 7 weeks from now is based on those March 26 projections, and if anything you're seeing is maybe changing your thoughts about when that peak may come?
Yeah. Thanks for that question. So the modeling, you know, I'm not sure precisely what website you're referring to. The one that's been reviewed by a lot of people in public health and the media is a group at the University of Washington that's making state-specific projections based on the data that we report publicly. And they're
Sorry to interrupt, Dr. Westergaard.
Yeah.
But no, this is modeling from the Department of Health Services, from you guys, that was done on March 26th, and it was just now posted to your dashboard.
Sure. Okay. So the models that we've used to present that the Secretary has talked about, our numbers, were based on data from the first half of March to look at to sort of make some projections in terms of how big and how many critical illnesses could result from the surge, knowing what was going on there. And I would say, sort of as I mentioned before, that the actual data initially for the second part of the month tracked pretty well. I think the data we're seeing now, which is still in evolution, is that the curve is thankfully flatter than it may have been based on those initial projections. So it's there's a lot of variability. There's a lot of uncertainty with regard to any projected curve, because we don't know the curve until we actually collect the data. But I think the initial projections showed what it would have been like if there was, you know, minimal or not implementation of safer at home. The data we're actually seeing are what we're experiencing with participation in the stay-at-home order. So that would be the difference. Secretary Palmer, did you have other comments about that? I know you've talked about that before.
Yeah, I think Matt, you have to understand, we aren't looking at the website like you all are, and so I think if you have further questions about that, probably the best thing to do is for us to connect with you afterwards, so we can all be looking at the same thing.
And our final question this afternoon goes to Anthony DeBruzzi from Spectrum News 1. Anthony?
Good afternoon. This was asked earlier, but really wasn't answered, and the question goes to either Secretary-designate Palm or Governor Evers. As I'm sure you're both aware, Ohio closed its polls just hours before they were set to open back on March 17th. The health director there is making an order on the ground. She has the authority to prevent the spread of contagious disease. Governor, you say your hands are tied, but is that something you would order here in Wisconsin of the health secretary, especially if the legislature takes no action during this special session?
But they take no action, we'll be looking at whatever action we can take. But I hesitate to compare Ohio to us. They had only a presidential primary. They're running a primary for the Democratic Party. We have, I think it's 6,000 general, folks that serve at the local level, at the state, at the municipal level. So the comparison between us and them is immaterial, but the issue that you raise is that we will continue to find ways to make sure that Wisconsinites are safe, and that's our bottom line.
Okay, thank you. And that wraps up today's media briefing. Please continue to monitor the DHS COVID-19 webpage as well as the Outbreaks and Investigations page for data and guidance materials and for answers to your questions concerning the COVID-19 response that are not related to public health. Please visit the websites of the Governor, the Wisconsin Economic Development Corporation, the Department of Workforce Development, and Wisconsin Emergency Management. Thank you and have a good weekend.